Future nurses, don't you want to know the treatment for DKA, diabetes ketoacidosis, which is a life-threatening complication of type 1 diabetes? And signs and symptoms you will see will be hyperglycemia, ketosis, acidosis, and dehydration. Now, use FIC to remember treatment for DKA. The first one is F, which stands for fluids. That is 0.9 normal saline fluids first, because DKA causes severe dehydration due to osmotic diuresis, that is from high glucose in the urine pulling water and electrolyte out. So you start with 0.9 normal saline, which is given typically 1 liter over the first few hours. And what is the purpose of giving normal saline, right? It restores circulating volume and perfusion. And it also helps the kidney to flush out the ketones and acids. That's why, okay? And the next one is I, which stands for insulin. That is regular insulin via IV. Now, insulin is needed to reduce the high blood glucose and reduce or stop ketones production. And remember, you have to monitor potassium level first before giving insulin. If potassium level is less than 3.3, do not give insulin first. Give potassium first, because you need the potassium level to be above 3.3 before you can give insulin. Why? Because insulin drives potassium into the cell, right? And you do not want your patient to have hypokalemia. This is why you have to monitor the potassium level first before giving insulin. Like I said, if potassium level is low, you give potassium first before you give insulin. And like I've mentioned, we give insulin to lower the blood glucose gradually and to correct metabolic acidosis. And the K stands for potassium replacement. Now, DKA initially causes high serum potassium due to the acidosis, and this means potassium shifts out of the cell. And with insulin and fluids, that help the potassium shift back into the cell, and this may cause rapid hypokalemia. And this is why I kept saying you have to monitor potassium level. And remember, guys, anything involving potassium, either hyperkalemia or hypokalemia, you have to monitor cardiac function, because hypokalemia or hyperkalemia can cause cardiac arrhythmias or dysrhythmias. So monitoring potassium level is very important in cardiac function. And last nursing consideration you have to know is you have to continue to monitor the labs. You have to continue to monitor the glucose to avoid hypoglycemia, because we've given them insulin, right, to lower that blood glucose. You have to also monitor potassium level to avoid hypokalemia, okay? And by so doing, you are able to save your patients and rescue them from DKA, which is a life-threatening complication of type 1 diabetes. Thank you.